Yeah, you're on.
This is Saran Kumar Reddy, a second MBBS student from Rajiv Gandhi Institute of Medical Sciences, Kadapa, Andhra Pradesh. And my topic is laboratory monitoring of antiretroviral therapy by CD4 count under the heading Study of Effectiveness of Antiretroviral Therapy among HIV positive individuals at RIMS Kadapa, Andhra Pradesh. As the main motto why I have taken this study was as our district Kadapa stood second among Andhra Pradesh regarding incidence and prevalence of HIV status, and all the HIV positive people who have decreased CD4 count less than 200 cells are going to take antiretroviral therapy. And I want to know what is the amount of effectiveness of ART among HIV positive individuals. So my introduction goes like this. As per World Health Organization guidelines, they suggest that CD4 counting to monitor antiretroviral therapy. And CD4 count is, as we all know, it's one of the important indirect predictors for HIV/AIDS. And my research question is mainly focused on what is the effectiveness of antiretroviral therapy among HIV positive individuals, and my material and methods. This is total study period of 2 months between August 2008 and September 2008, and it's a total sample size of 900 people who are coming to antiretroviral therapy clinic at RIMS Kadapa between those periods. And inclusion criteria are those people with CD4 count less than 200 cells, and they should be on ART at least for 6 months, and it may go up to 18 months. And my exclusion criteria is those people whose CD4 count is greater than 200 cells and with ART less than 6 months. And my methodology goes like this. Actually, what I done was it's a retrospective study of people who are attending antiretroviral therapy clinic at RIMS Kadapa, and between the period of August and September 2008, and all the CD4 count for the people who are coming for ART clinic was done through flow cytometry method. Why I choose flow CD4 count instead of RNA viral load, though it's very effective and means this CD4 count is flow cytometry as it's cheap and it's inexpensive and it's easily available, and when compared to RNA viral load, and it's not flexible to use in our situations. And CD4 count was done and the results were analyzed. What were the results? Coming to my results, the total number of cases for CD4 count between those periods, that is August 2008 and September 2008, was 900. Out of those HIV positive individuals with CD4 count less than 200 was 285, and out of those people with less than 200 CD4 count, those who come for first visit, that means they are coming for the first time to antiretroviral clinic, is 88, and those HIV positive patients with CD4 count less than 200, and those are called repeaters. These repeaters may be of three categories. They will be second visit, third visit, or fourth visit. That means for who are in ART for at least 6 months, 4 months, and 18 months. And those are a total of 197. I categorized these 197 people into, out of these 285, 88 are who came for first visit, and I categorized these 197 into three categories. This is second visit, third visit, and fourth visit. What does that mean by second visit means? Second visit means that they had taken ART for at least 6 months, and third visit means they had taken ART for at least 12 months, and fourth visit they had taken ART for 18 months. Out of these, I mean to say what is increased CD4 count on subsequent visits. Increased CD4 count on subsequent visits means when you come to after 6 months, second visit, there are only two probabilities for us. Either there may be an increased CD4 count or decreased CD4 count. Out of those 69 people, 62 people, so 61 people had their increased CD4 count, and after 12 months, they had totally 51 people with increased CD4 count, and 20. And after 18 months, totally 18 people had their increased CD4 count subsequently on every visits. And the non-responders to ART, after 6 months of ART, it's 8, and after 12 months 25, and after 18 months it's 7, and it goes to totally 40. And my conclusion is the effectiveness of ART, which is assessed through CD4 count difference between the pre-ART and post-ART, is positive. That means there is increased CD4 count in 79.7% of the people and negative in 20.3% of the people. And my discussion, the present study approximately correlates with the NACO studies, and my future perspective is to find out the reasons for decreased CD4 count, and what are the factors responsible for non-responsiveness and other factors influencing CD4 count. And my references are IPSAX, NACSO, and Mendel and Bellman test. And thanks to Medicom.